this is really bizarre if you think about it, because, of course, I believe physicians all have jumped on this and they do everything they could, but it hasn't worked out that way. If you talk to people working on safety and quality improvement in a lot of places, their biggest problem is getting cooperation, participation. And part of that has to do with the fact that we have, since time immemorial, taught physicians that, as individuals, not as team players, and we have taught them that it's their job, your job, is what you get, to do your homework, learn your lessons, be on top of things, know what you're doing, be an expert, and then do the right thing. And it's your judgment. It's not what everybody else tells you to do. You have to make your own decision because you are individually responsible. And it's been preached under the rubric of autonomy, that nobody can tell me how to practice. An awful lot of physicians really buy into that. The combination of a sense of responsibility, and therefore I have to do what I think is right, regardless of what other people say, and a sense of entitlement that I've spent a lot of time and effort learning this sort of stuff, and so people should do what I say, leads them too often to, for example, say, I don't need to do a checklist. I don't need to do a timeout. I don't need to wash my hands. Now, isn't it quite remarkable that Atul Gawande published this study about surgical checklists 3 years ago? Time flies, 3 years. Showing almost 50% reduction in surgical mortality and complications. I mean, my God, to do a study with that kind of impact blows you away. I mean, it must be giving a 10% change. That's great. But he really knocked mortality, the big one, and complications down by almost half by putting in a surgical checklist. You would think the world would be the footpath to his door. Show me how, when can I do it? Put it in tomorrow. No way. Today, there are still dozens of hospitals, hundreds of hospitals, where there are surgeons who won't use a checklist because they don't need to. I don't believe it. I don't agree. What we're talking about here is really kind of simple. This is disrespect of other people's expertise. This is saying, I don't respect the science or the experts and the people. I think my opinion is every bit as good and so forth. And so, therefore, I'm not going to do it. The best hospitals get sometimes up to 85–90% compliance with hand hygiene. How many of you have ever been in an operating room where somebody came in and went up to the table and hadn't scrubbed? Of course not. Of course not. It's 100% in operating room. Why isn't it 100% down the hall? Ask yourself why. Anyway, I would suggest to you that this is a bigger issue than a disrupting job, because the failure to follow safe practices causes harm. There's been a recent study that showed the relationship of hand hygiene to hospital-acquired infections. Clear relationship. There's no question that the checklist makes a difference. So failure to follow safe practices is a threat to patient safety. And of course, failure to participate in teams because you don't respect other people and don't treat them with respect means it's very difficult to make progress. It's very difficult to implement new safe practices if you can't have the teamwork. The essence of teamwork is respect. And if it's not shown, you're not going to get there. So I would suggest to you that this issue of passive disrespect, passive resistance, is a very crucial one, and maybe more serious than the disruptive. The third is something you've never thought of at all, and that's exactly what I want to tell you about. And that's called institutionalized disrespect. This is the stuff we take for granted because it's part of the wallpaper, it's part of what we do every day. It's the way things are, and I really never thought much about it, except it happens to be very relevant, and it happens to be very relevant to safety and what we're talking about. And there are two aspects of this. One is institutionalized disrespect of us, those of us who work there in the workplace, and the other is institutionalized disrespect of patients. By the way, these slides will be made available for you guys, so you don't have to write down what you see. We're happy to share with you. Let's look at the workplace environment issue first. The first thing is sort of practical, physical disrespect, meaning things that are harmful to you in a physical way. And the most obvious thing is to do with the whole issue of worker safety. Did you know that healthcare has one of the highest worker injury rates of any industry in America, exceeded only by mining? 3 times the industrial average, 30 times the rate of Alcoa, aluminum manufacturing. 30 times as many worker days lost because of injury per year, per 100 workers. We're near the top as a hazardous industry. The needle sticks, the back strains, the assaults on patients, things like that. So that workers are treated with disrespect to the extent that we don't do everything we can to prevent these issues. We don't do everything we can to keep our nurses, doctors somewhat, and other workers as well, from having injuries on the workplace. Serious issue, really a serious issue. Second, work hours. This one has been really worked over a lot. I think many of you know where I am on this, but leaving aside all the heat and controversy, the evidence is very clear. The science is very clear. If a physician, or nurse, but we're talking mostly about physicians here, has been up all night, is sleep deprived, he or she is much more likely to make a mistake that will harm a patient, is much more likely to have an automobile accident while driving home, and more likely to die from that accident. So sleep deprivation is hazardous to your health, and it's hazardous to the patient's health. So when we ask people to do that, we are asking them to, we know the science, because the science is clear, so we are knowingly asking people to do things that we know make it more likely for them to harm somebody else than themselves. That's got to be the height of disrespect. The same with workloads. When nurses have to take care of too many patients, when residents have to take care of too many patients, they have to cut corners and more likely to make mistakes, more likely to hurt people. It is the height of disrespect to put somebody in a situation where you are forcing them to hurt somebody else. I had a meeting with, in my course, we had a half a dozen surgical residents and students, and they wanted to get together because I'm a surgeon, they like to talk about surgery and quality and so on. I said, sure. So we got talking about this, and one of the surgical residents, she's a third-year resident, she said, you know what bothers me about this? She says, I don't mind working hard. I don't mind working 16 hours a day. She says, what I mind is that I am so overworked that I can't give good care to my patients. And she said, I really